Welcome to myeyecademy.com. I'm Professor Mahfooz from Pakistan. In this video, VMCQ 12.1, we are going to discuss the Neurophthalmology MCQs number 1. Before starting the MCQs, let's go through a couple of slides. Optic atrophy, clinical classification. What is optic atrophy? When the optic nerve stops functioning and becomes white because of the atrophic changes, we call it optic atrophy. There are 4 types of optic atrophy: primary, secondary, consecutive, and glaucomatous. In the primary optic atrophy, there are no signs of edema or inflammation, so the optic disc margins are very clear. Look at the optic disc margins. They're very distinct and clear. Secondary optic atrophy is secondary to preceding optic disc, which could be because of different clinical conditions. So because of the swelling, the optic disc margins will be blurry, that you can see here. Then is the consecutive optic atrophy, which is secondary to a retinal disease. So in addition to the optic atrophy, you can see the retinal disease signs as well. And glaucomatous optic atrophy is secondary to glaucoma, in which the cup is quite big, though the margins are clear. So these are the 4 types of optic atrophy according to clinical classification. Let's make your concept a bit more clear before going into the MCQs. Secondary optic atrophy could be because of inflammation, ischemia, or papilledema, and the optic disc margins are unclear or indistinct or irregular. Primary optic atrophy, the optic disc margins will be clear but no cupping. In the retinal disease, the optic disc margins will be clear but there will be signs of retinal disease. And in the glaucoma, optic disc margins will be clear but the cup will be bigger than usual. So these are the 4 types of optic atrophy. Let's start the MCQs. MCQ number 1. Primary optic atrophy can be caused by glaucoma, optic neuritis, papilledema, retinal disease, or trauma. Remember, glaucoma causes glaucomatous optic atrophy, optic neuritis causes secondary optic atrophy, papilledema causes disc swelling and secondary optic atrophy, and retinal disease causes consecutive optic atrophy. So the answer would be trauma, that causes primary optic atrophy. Let's see. Trauma is the answer. Next MCQ. Consecutive optic atrophy is caused by, remember, consecutive is caused by a retinal disease. So one option is glaucoma, that is out. Hereditary, Leber's optic atrophy, hereditary ones are cause primary optic atrophy. Papilledema, that causes secondary optic atrophy. Retinal disease, that's the likely answer, because the final option is tumor, which causes primary optic atrophy. So my answer would be retinal disease. Let's see. Retinal disease is the answer. Next MCQ. Secondary optic atrophy results from, remember, 4 types of optic atrophy. So secondary optic atrophy results from inflammation, glaucoma, retinal disease, trauma, or tumors. Tumors and trauma cause primary optic atrophy, retinal disease consecutive optic atrophy, glaucoma causes glaucomatous optic atrophy, so we are left with inflammation. Let's see. Inflammation is the answer. Before starting the next MCQ, let's discuss the disc swelling and the causes of disc swelling. Disc swelling can be pseudo disc swelling, in which it looks like a swelling but actually it is not a swelling, or a true swelling, which is because of these conditions. Pseudo papilledema or pseudo disc swelling can be because of disc drusen's, myelinated nerve fibers, tilted disc, or hypermetropic disc. In these 4 conditions, the disc looks swollen but is actually not swollen, so we call it pseudo papilledema or pseudo disc swelling. The conditions that cause disc swelling or optic neuritis increased intracranial pressure, in which condition is called papilledema, ischemic neuropathies, infiltrative neuropathies, compressive neuropathies, mitochondrial optic neuropathies, and increased IOP. These conditions cause true swelling, and these four conditions here, they cause pseudo disc swelling. So let's start the MCQs. Pseudopapilledema is caused by disc drusen's, increased intracranial pressure, central retinal vein occlusion, optic neuritis, mitochondrial optic neuropathies. Mitochondrial optic neuritis do cause disc swelling, so it's true swelling. Optic neuritis is inflammation, true swelling. Central retinal vein occlusion, engorgement of the vessels, and true swelling. Increased intracranial pressure causes papilledema, which is a true swelling. So we are left with one option, which is disc drusen. Let's see. Disc drusen is the answer. Next MCQ. Pseudopapilledema is caused by myelinated nerve fiber, increased intracranial pressure, central retinal vein occlusion, optic neuritis, ischemic neuropathies. So my answer would be myelinated nerve fibers. Myelinated nerve fibers is the answer. Next MCQ. Next MCQ. Patient has right optic atrophy secondary to optic neuritis. Light shown in the right eye will constrict right pupil. Remember, right eye has got afferent pupillary defect, while the left eye don't have any pupillary defect. So if we show light into the right eye, it will not constrict any pupil. But when we show light into the left eye, it should constrict both pupils because the efferent pathways are intact in both eyes. So with this knowledge, let's start. Light shown in the right eye will constrict right pupil. No, because the afferent pathway is cut down. So that's gone. Light shown in the right eye will constrict both pupils. No, it will not constrict either pupil. Light shown in the left eye will constrict left eye. No, it will constrict both pupils. So that's gone. Light shown in the left eye will constrict both pupils. Yes, if you show the light in the left eye, afferent pathway is intact and it will constrict both pupils. So that should be the answer. Light shown in the left eye will not constrict both pupils. No, it will constrict both pupils. So the answer is number 4. Let's see. Light shown in the left eye will constrict both pupils is the answer. Next MCQ. Addis pupil is usually because of the lesion of. Remember, Addis pupil is a lesion of parasympathetic system, and the lesion is usually in the ganglion, which is within the orbit. So the options are sympathetic system, Edinger-Westphal nucleus, ciliary ganglion, lesion in the sphincter pupillae muscle, dilator pupillae muscle. Sympathetic system is not involved in Addis pupil. Edinger-Westphal is a central nucleus, so that's not an answer. Ciliary ganglion is in the orbit, so that may be the answer. And the last two options are not for the Addis pupil, so my answer would be number 3, ciliary ganglion. Ciliary ganglion is the answer. Right optic tract lesion will cause. Remember, the optic nerves cross, and this part is called optic tract. If the lesion is in the optic tract, temporal fibers will be involved here and nasal fibers will be involved in the other eye. So one optic tract lesion causes blindness in the opposite visual field. So let's see the option. Right optic tract causes right homonymous hemianopia, left homonymous hemianopia, right total loss of visual field, right quadrinopia, bitemporal heteronomous hemianopia. Bitemporal is only when the lesion is in the middle. Quadrinopia is only when the vision is more posterior. Right total loss of vision is when the optic nerve part is involved. Left homonymous hemianopia, the right optic tract lesion causes opposite, so that would be the right answer. Right homonymous hemianopia is not a probable answer, so my answer will be number 2. Left homonymous hemianopia is the answer. In retrobulbar neuritis, the part of the optic nerve affected is retinal nerve fibers, optic disc head, intrascleral part of the optic nerve, part just behind the globe, or chiasma is affected. Remember, the optic nerve starts as fibers in the retina, then there is intrascleral part, and then the part just behind the sclera is called retrobulbar. So my answer would be part just behind the globe, because that is called retrobulbar. Let's see. Part just behind the globe is affected is the right answer. Thank you very much for being with me, and please do give your feedback at youtube.com/@Professor Dr. Mahfooz 7544. Thank you.